Hello friends, today I am going to explain about topic nosebleed. The definition of nosebleed is hemorrhage from the nose is caused by the rupture of tiny distended vessels in the mucous membrane of any area of the nose, and the mostly commonly the site is the anterior septum where three major blood vessels enter the nasal cavity. The three major blood vessels are anterior ethmoidal artery on the forward part of roof, and the second is the sphenopalatine artery in the posterior superior region. Third is the internal maxillary branches, the plexus of veins located at the back of lateral wall. This is the picture of nosebleed. And if nosebleed is caused, we want to sit in proper position. This is proper position, and the second is we can't sit in while nose bleeding. Next, the classification of nosebleed is divided into two types: anterior epistaxis and posterior epitaxis. Anterior epistaxis is more common, posterior epitaxis is less common. Anterior epistaxis are mostly from little area or anterior part of lateral wall. Posterior epistaxis is mostly from posterior superior part of nasal cavity. Anterior epistaxis mostly occur in children or young adults, but posterior epistaxis occur after 40 years of age. Anterior epistaxis mostly trauma, but posterior epistaxis is spontaneous, often due to hypertension or arteriosclerosis. Anterior epistaxis, usually mild, can be easily controlled by local pressure or anterior peg, but posterior epistaxis bleeding is severe, requires hospitalization, and postal frag often required. The first aid of nosebleed is pinching the nose with the thumb and index finger for about 5 minutes. The compresses the vessel of little area. In Totter's method, patient is made to sit leaning a little forward over a basin to split any blood and breathe quickly from the mouth. Cold compress to nose to cause of relief vasoconstriction. Causes: trauma by trauma causes, physical trauma such as blows or accident, operative trauma, exposures to dry air for prolonged periods, high altitude, infections like influenza, typhoid, measles, rhinitis, sinusitis, cancer of nose, blood disorder, severe anemia, leukemia. Drugs are aspirin, quinine. Types: spontaneous. It is commonly in children. It arises from little area. It may be precipitated by infection or minor trauma. Hypertensive. It affects older people. It arises far back or high up in nose. It's often difficult to stop. Symptoms are bleeding, dizziness, confusion, bleeding from teeth, gums, nostrils. Diagnosis: X-ray, computer tomography. Management: a nozzle, spectaculum, pen light, or headlight may be used to identify the site of bleeding in nasal cavity. Apply ice or cold water. Or Totter's method: make the patient to sit with open mouth till the pressure decreased by bleeding. And another management is by giving vitamin C 500 ml tablet 2 to 3 times a day, or injection like vitamin K injections. Next, the complications are hypotension, shock, anemia, secondary infection. The procedure of treatment is: sit the casually down with the hair head tilted forwards. Do not let the head tip back. Blood may run down the throat and induce vomiting. Yeah, first only I showed now on picture. Next, tell her not to speak, swallow, cough, split, or sniff, as she may disturb blood clots. Give her a clean cloth or tissue to mop up any dribble. Next, treatment of nosebleed is: the first our aim is to stop the nosebleed is to control blood loss and to maintain an open airway. That's all, friends. Thank you.